Hi everybody, I'm Dr. Norma Hilsman, and this little presentation will be on evaluation, looking at both process, impact, and outcome. So I want you to think about evaluation in relevance to what project you're working on. For this particular project that you might be working on, evaluation does not represent the overall goal, but maybe the process, and specifically looking at what your output is. So process evaluation, I want you to think formative. As you're going along through the journey of your project management, you need to be evaluating how are things going, what needs to be tweaked or made better in order to impact the end product. So the purpose is to look at ongoing feedback during the implementation process and to improve performance and outcomes. It evaluates your steps forward towards an effectiveness of the process. So think again about the timing. It's conducted during the instructional or project phase, and the focus is to identify the gaps, strengths, and areas for improvement to refine the process while you're in it. If you're unable to make changes to certain things that are unfolding, then maybe for next time around, there's always a learning that can occur. It allows you to track your program information related to the who and the what, when, and where questions. So some key characteristics is diagnostic and developmental. Okay, think diagnostic and developmental. So it's low stakes, usually informal. Often it's not from an evaluative, graded, marked perspective, but rather just making the process more smooth line. Encourages adjustments and improvements. Summative thinking. This is what I want you to consider when doing impact evaluation. You've come to the end and you want to see how things have turned out. So the purpose is to assess the success at the end of the process. It evaluates the impact and what changed. Think of the timing. It's conducted after the implementation or instruction, and its focus is to determine whether goals and objectives were met. It measures program effects in the target population by assessing the progress in the project outputs. So some key characteristics, it can be judgmental and output focused. So you have to look at and make judgment calls as to how it worked out. It is more high stakes and often linked to grades, promotion, or funding. And it focuses on accountability and certification. Now, outcome evaluation, I want to point something out. What I have learned is that outcome evaluation and impact evaluation often can be flipped. So whatever option you choose, whether impact evaluation is at the end of the product and the outcome evaluation is kind of more the long-term meeting of your ultimate goal, or vice versa, whatever it is, make sure your team is all working with the same understanding. Okay, be consistent. So the purpose of your outcome evaluation for this project would be to assess the long-term impact. Okay, I want you to think about how it measures the degree to which the program met its ultimate goal. When considering the timing, it's conducted after completion, often months, sometimes even years later, and it measures the real-world impact or behavior change resulting from the intervention or the project. For example, tracking changes in clinical practice after a professional development program, or evaluating the impact of a new teaching strategy on participant outcomes, or measuring knowledge retention and application post-certification. Its key characteristics, it's focused on lasting outcomes and sustainability. We want measures changes in behavior, knowledge, and attitudes over time, and it's high stakes for program justification and policy decision making. So I want to thank you for taking the time to listen.